Welcome to this module covering health, safety and well-being. So let's start by looking at the benefits of good health and safety practice against the costs of poor health and safety practice. The benefits include an increased quality of care for the people that you support, a safer working environment for you, your colleagues and the people you support, fewer accidents will be caused, you will have a more productive workforce, there will be less chance of prosecution for yourself and for the organisation, there's less chance of civil action being brought against you, you bring greater profits for your organisation and your company will have a better reputation. It will also result in lower insurance premiums for your company. For costs, poor health and safety practice can lead to increased claims for compensation from people who have been injured. There will be a loss of production within your organisation. Staff and service users who have been injured might need treatment in hospital. There will be an increase in accidents and potentially in serious accidents. There's an increased chance of prosecution. The company's reputation is going to suffer. If that suffers, then there is less chance of your organisation attracting new clients. It can lead to pain and suffering for people who have been injured, and ultimately it could lead to death. We'll have a brief look at the health and safety legislation. As with all sectors, health and safety legislation is very important in the social care sector. The main piece of legislation is the Health and Safety at Work Act 1974. This legislation places certain responsibilities for health and safety on the employers, on the employees, and on anyone else who accesses the workplace. That can be contractors, it can be family and friends, it can be other health professionals. So what are responsibilities of people under the health and safety legislation? The employer has many responsibilities. The main ones include ensuring that there are agreed ways of working in place. Agreed ways of working include things like policies and procedures, risk assessments, care plans. They're also responsible for reviewing and updating these regularly. Your employer is responsible for providing all necessary training to allow staff to work in a way which keeps everybody safe. They're also responsible for providing any equipment that is needed to allow staff to carry out their duties safely, and they also have to make sure that it is well maintained and safe to use. The employee's responsibilities include to read, understand and work in accordance with all the agreed ways of working. You must do this at all times. You have to be alert for and immediately report any changes that you notice which could necessitate a change to the agreed ways of working. So if a risk assessment is in place and it talks about how to safely transfer an individual, if the individual's ability to weight bear or transfer changes, you must report that immediately because that risk assessment will need updating. You are responsible for your own training as a care worker, and you must attend all training which is provided for you, and you must go back into the workplace after and implement what you've learned. So if your ways of working have changed as a result of that training, you must make sure that you work in that way in the future. You cannot go back to your old ways of working. You're also responsible to use all equipment provided as you have been trained to do. And you must check that equipment before you use it, and if there's any issues, you must report it. You cannot use that equipment if it is faulty until it has been repaired. Others, like we said, that can include health professionals, contractors, family and friends. Their responsibilities are covered basically with one sentence, that they must behave in a way which does not put anyone else at risk. So whatever they do when they're in that service must not put anybody else at risk. So looking at common occurrences, common hazardous occurrences which happen in care. As you can see, slips, trips and falls, most common injuries that you will get in the care sector. They cost the UK nearly £1 billion through paying compensation and through the loss of productivity. 57% of major specified injuries are caused by slips, trips and falls. Slips, trips and falls cost employers over £512 million in lost production every year. Over 1.5 million lost working days per year are lost due to slips, trips and falls. 36% of all reportable accidents are due to slips, trips and falls. Over 40 fatalities annually can be attributed to slips, trips and falls. That can be staff, it can be service members. Manual handling. 44% of handle injuries are back related. You only get one spine. You damage that spine, it is going to cause you problems for life. This is why it's important you follow the correct procedures when manual handling. Over 2.3 million working days are lost each year due to handling injuries. 6.6 days are lost for each manual handling injury. So that is the cost of staff being off sick for 6.6 days every time they injure their back. 5.7 billion is the cost to society from handling incidents. So why do accidents occur from manual handling? You attend a training session, you're taught how to safely manually handle people, you then go out into service. If you follow the procedures, if you follow the safe principles of manual handling, you should not have any accidents. But accidents can and do happen. The reasons for this are going into services where there's a lack of mechanical aids, staff using equipment incorrectly, cutting corners to try and save a bit of time, badly planned tasks where staff aren't planning how they are going to carry out that task properly, or where they aren't following the service plan, where staff are sent into service with insufficient or no training. If you haven't had manual handling training, you should not be manual handling, so speak to your manager about that. An unsuitable working environment. Sometimes, particularly in domiciliary care, you will end up working in very cramped conditions. It's important you make that environment safe before you actually commence any manual handling. Poor communication between staff, so on a two-handed call, that could be you and your colleague, or poor communication with the service user as well. If everybody doesn't know what they need to do and when, it will lead to accidents. So communicate clearly. And staff's behaviour and complacency. One of the easiest ways to make errors is when you become complacent, where you've done that task every single day and you think you know how to do it perfectly. You get complacent, you start cutting corners, and accidents will happen. Control of substances hazardous to health. Control of substances hazardous to health is sometimes abbreviated to COSH. It's a very important piece of health and safety legislation tied to the Health and Safety at Work Act. What it does is it explains how you work with hazardous substances. So think, what hazardous substances do you work with in your job role? COSH dictates the way that we must work with hazardous substances. The main hazardous substances you will come into contact with as a care worker are body waste, cleaning substances, and medication. All of these hazardous substances must be treated in a certain way. We have to store them, use them, and dispose of them according to procedures. So body waste, although we don't often store body waste, if we do need to store it for tests to be carried out on it, we must store that sample in the correct container. It must be labelled, it must be sealed, and it must be stored in an appropriate place. This means somewhere where it's not too hot, where it's out of direct sunlight. If we're ever having to deal with body waste, we must bear in mind it's a biohazard and we must follow universal precautions. This means we must wear the correct PPE for the task. Disposing of body waste, depending on what the body waste is and where it is, it will be disposed of either in the clinical waste bag, down the toilet, or in a sluice. Cleaning substances must be stored in a locked cupboard. They must be removed only when you need to use them, and when you've finished with them, they must be returned and locked away again. When using any cleaning substances, you must follow the instructions for use and you must wear PPE. If you're disposing of it when it's finished, you rinse out the bottle, you replace the lid, and then you dispose of it in an outside bin. For medication, it must be stored in a locked cupboard. It must be removed only to administer it to the people that need it, and then it must be returned to the locked cupboard when it's finished. It can only be administered by trained staff. You must follow the doctor's instructions at all times, and all details as to what has been given or why it hasn't been given must be recorded on the MAR chart. All spoiled, surplus or discontinued medication must be returned to the pharmacy. Fire prevention. It's important that we control the risks. So in any care setting, always be aware. Identify the potential fire hazards and minimise the risks. You must remove rubbish and waste products from the premises regularly, so these aren't allowed to build up. You must take care with flammable materials and liquids. You must unplug any non-essential equipment when it's not in use. And you must smoke only in designated areas outside the workplace. You must never overload electrical sockets. You must not block air vents on equipment. You must not put out cigarettes in waste paper bins, and you must never put anything on top of a heater. Accident reporting and recording. Employees must report to the employer any accidents, injuries, and even near misses. A near miss is where something could potentially have happened but didn't. That doesn't mean it won't happen again in the future, so it must be reported. Every workplace must have an accident book. An employer must investigate any accident that has been recorded in that book. This could lead to a change in the risk assessments, a change in training, or a change in working practices to stop that happening again. Accident forms must be completed whenever there is an accident in the workplace, and they should contain the name of the injured person, the date and time of the injury, a description of the accident and the nature of the injury, the action taken and who has taken that action, and any final outcome must be documented also. The person reporting the injury if it is not the injured person themselves. Thank you for watching this presentation.